Hi, my name is Morgan Sumner. It is March 18th, 2024, and it is currently, what time is it? It's around 9, and I will be walking through my practical. So first for oral medication, you're gonna wash your hands for about 60 seconds. So you make sure you get between all your fingers, you get your palms, you get under the nails, you get your top of your hands. You do this for about 60 seconds. Make sure your hands are thoroughly clean. You're going to confirm the patient and with the MAR, and you're going to do that about 3 times. And what you're going to do is you're going to confirm that it's the right patient, the right medication, the right time. You're going to confirm all that with the MAR. Make sure you do it 3 times just to like triple check to make sure it's correct. And then you're going to go through the 7 rights, which is the time, make sure it's the right time, the right patient, the right dose, the right route, the right medication, the right documentation, and the right to refuse. So we're going to document on the MAR the meds that are given, and we are going to have the patient sit straight up in a chair, and we're going to offer them a drink just in case they need a drink so they can swallow their meds correctly. We're going to put the med cup on the back of the med pill pack, and we're just going to pop it in. And when we pop it in, we are not going to be touching the med at all. It's just going to go straight into the cup. We are going to, for example, I guess give 1 tablet by mouth. That's what we would have to do, give to the patient. So we are going to give the patient that 1 tablet in the cup and their cup of water, and they're going to take the med and then take some water afterwards. And we're going to make sure that they're taking their meds within half an hour of the time frame they do have to take their meds. And we have to make sure we are there to witness them take their meds. And we have to initial on the MAR that their meds were taken. And then if we don't know the med, we have to give it to a source. And, well, not give it to a source, but we have to verify with a good source, like such as the nurse or the doctor or the pharmacy, if we don't know that med. For liquid meds, we're going to put the cup on the surface, on a flat surface, of course. And we're going to pour the liquid in at eye level. And we're going to put our hand over the label to make sure we don't get any liquids on the label. And we're going to also offer a drink so they can have a drink after they take their med to wash it down. For sublingual, we're going to have the patient put the med under the tongue, and they have to let that med fully dissolve. We are going to document the time that it was given, such as what we do with all of our meds. For eardrops, we will look at the MAR and see how many drops it tells us to give them. And we're going to have the patient sit straight upright with their head tilted. And we're going to make sure we have hand sanitizer and gloves on. And afterwards, we are going to put hand sanitizer back on or rewash our hands. And it's the same for eye drops, but for eye drops, we are going to tilt the patient's head back. We're going to make a pocket. We're going to drop the thing into the pocket and, well, not the thing, but like drop the med into the pocket, and then we're going to record the time, wash our hands, make sure we're wearing gloves this entire time since we are coming in contact with the patient. For topical creams, you have to also wear gloves, and what helps is if you walk the patient through it. We are going to tell the patient like where we're putting the cream and why we're doing the cream. And we're going to make sure that it's the right area that we are applying the cream by checking the MAR about 3 times. For nasal spray and inhalers, we are going to walk the patient through it. And for nasal spray, we're going to have them count to 3 and then have them breathe in as soon as we hit 3 so they can inhale the medication. For inhalers, we're going to double check and triple check that we are giving them the right amount of puffs. And we're just going to put it up to the mouth and say, okay, on 3, breathe in, and then we press down. For patches, we remove old patches. We don't put new patches where the old patches are unless specified that is the spot that we need to constantly keep the patch on. And if that's the case, we have to thoroughly wash the area. Make sure we're wearing gloves during this, as well as everything I said before, because we don't want to get that medication on our hands. We are going to, for patches, date and initial them as well, just so we know like what date the patch was on and who put it on. For filling the med reminder box, we are going to write the patient's full name. We are going to put the meds in the exact order that they are supposed to be given. We are going to use gloves or tweezers to put the meds in there. And again, we have to make sure the meds are in the correct spot. For suppositories, we have to make sure there is privacy for both rectal and vaginal. We are going to walk the patient through it, and it's good to have support there with you to also help comfort the patient and walk them through it to make sure they are aware of what we are doing. For both rectal and vaginal, we are going to put the suppository up 2 to 3 inches in, and we are going to have the patient relax. But for rectal, we are going to position the patient on the left side and, of course, use gloves and lube. And for vaginal, we are going to have the patient on their back with their knees up and bent, and we're also going to insert the suppository 2 to 3 inches in.